Welcome. I'm Kim Evans, CEO of Serenity, your moderator for Reimagining Care, the intersection of tech and touch. The very good news is devices and digital health tools are plentiful, yet consumers are still challenged with finding and understanding and having access to the right healthcare plans, the right healthcare app, the right digital tools that meets their needs in a seamless and affordable way. The health systems are challenged with minimizing risk to their businesses and patients while keeping pace with changing consumer demand. And everyone is still interested in what is on the horizon that will improve the well-being of our communities in a compelling way. And yet we still are trying to get that right balance of tech and human integration. It continues to be as elusive as the Holy Grail. Fortunately, we have three accomplished individuals that have devoted their careers to improving the lives of others. Welcome Bill Hawkins, former Chief Executive Officer of Medtronic, Frank Lehausen, Managing Director of Medcom in Cologne, Germany, and Dr. Jim Linder, Chief Executive Officer of Nebraska Health.
Hi, well, I'm Bill Hawkins, and I'm the former chairman and CEO of Medtronic, one of the world's largest medical technology companies. And I've had the privilege for most of my career to work in the life sciences industry. And since retiring from Medtronic almost 10 years ago, I've stayed active in not only the medtech industry, but I've been working in the exciting new field of gene therapy. And I've had the privilege for the last 7 or so years to work with the Duke University Health System. And today I'm the chairman of the board of Duke Health. It's pretty remarkable when I think back over the last 40 years how technology has advanced. And today, it enables us to do things that we couldn't even have imagined, 5 to 10 years ago. When you think about what's happening with computer processing and what we can do there with the advent of artificial intelligence and machine learning, and even with capabilities around sort of MEMS technology or micro machining technology and nanoparticle tools, we have now capabilities that allow us to think about, managing patients and caring for patients in different settings than we could have ever dreamed of, 10 or 20 years ago, allowing us to bring patients out of the hospital into the home so that we can monitor them, we can rehabilitate them, we can treat patients, at places other than the hospital. And with this sort of new setting, we not only treat with the devices or therapies, we help really treat, the patient and the whole psychology of care.
Excellent. Frank?
Yes, hello, from Germany, Cologne. My name is Frank Lehausen. I'm partner with Medcom International. We are a consulting company focusing on aging and health. And to give you a bit of my background, out of Germany, we are a pretty dense country with more than 80 million population. We are lucky with a good social security system, including a mandatory long-term care insurance since 1995. And the thing what keeps me working and going is the fact that we have a lot of innovation, a lot of tech, but data shows us that we have still 14% of our population offline, so you can't reach them digital, they cannot use digital tools. And we have another 22%, which we call minimalistic or conservative casual users. This is the generation 50 to 60, family caregivers, people who just retired. And I see a lot of potential in our technical innovation, but I think we have to take the people with us. We don't have to talk about ownership, we have to talk about usership, and that's my big point, really, to get the digital divide closed and let everybody get the advantages of the new technologies.
Thanks. Dr. Linder.
Thank you, Kim. Jim Linder. I've been the Chief Executive Officer of Nebraska Medicine for about 3 years now. And I got to admit, it's been an interesting time to be a CEO of a health system. I had worked at the university for close to 30 years in a variety of other roles as a pathologist and as an administrator, but this one has clearly been the most interesting. Each year, we take care of about 30,000 inpatients, about 250,000 outpatients, tallying up to about 1 million visits a year. And plus, Nebraska, being a rural state, we have significant outreach to rural communities so that they have access to healthcare. And we're involved in training the next generation of healthcare professionals. The thing I would observe is if you think about care, hands-on care has been that way as long as there's been people we call physicians. They might have been magical and priests at one times, but that's really what care is about. But we are in a situation now where with advanced diagnostics, with monitoring and new technology, we can greatly improve the care that's provided by our professionals and do it in a much more efficient way that's beneficial to the healthcare consumer.
Yeah, you all have really pointed out some key things as we are really living reimagining health. We're really living in real time of that. The fact that there are so many more options and there's so much technology and even setting choices. How do you ensure that technology, innovation, and AI solutions are accessible? So, Jim, for Nebraska Medicine, how are you making sure that your communities have access to technology and understand it, know how to use it? And also for you, being over a medical system, making sure your clinicians and the medical personnel are trained up on it, comfortable with it, and embrace it as well?
Those are great questions. First of all, I think as a society, we have to adopt the philosophy that access to the internet is a right in the same category as clean water. Mm-hmm. Because so much of our world now revolves around digital communications. So we have to make sure that that access is available to every community. And in a state like Nebraska, that last mile problem has been challenging. But I look forward to being solved in the next couple of years as we have more satellite communication. And then if you think about the gamut of users from the young to the very old, I think a lot of work has to go into the user interface and the user experience. Because if you have great technology, but an obtuse black hole that you don't know how to interact with, people get frustrated. And that's true for both the patients and, as you pointed out, the caregivers themselves. They want things that are seamless and intuitive. So it is really a great experience for everyone. Like many systems, we saw a great bump in the use of telehealth with the pandemic, and consumers are very satisfied with that. So it's a great tool for us to communicate with patients.
So the pandemic, I think, has really brought to life both the opportunities, and the challenges of, caring for patients outside of the hospital and in the home. I think Jim said it well. I mean, the internet or the Wi-Fi is really kind of a right, but unfortunately, particularly in this country, with the different disparities, I mean, it's not the technology is, in this case, the technology is not the problem. The challenge that we have more in this country is one of affordability, it's one of access, it's one of dealing with some social issues around, education and poverty. And we need to deal with some of these, I think, fundamental foundational issues. And then we have the technology today, we have the capabilities, we can do things, as I said, that we couldn't even have imagined 10 years ago, but we've got to address some of these other issues that would then allow us to take advantage of the technology and to be able to then care for patients or people in places other than in the hospital or the ER, but in their homes. But for people to embrace this technology, they have to have the financial means. They have to, be in a position where they can understand it. We need to educate them. So there's a lot of, I think, social issues that need to be addressed before, we can make this, sort of ubiquitous.
How are healthcare systems evolving their services based on consumer demands as well as change in demand due to COVID? You have mentioned it's been a game changer. Let's kind of go a little deeper in that and truly how it has exposed some things, opened up new avenues of healthcare, just kind of shown us different alternatives. I'd like to hear your thoughts about that.
Well, again, N of one, if you look at in Duke, which is in Durham, North Carolina, pre-pandemic, the virtual visits, which is the combination of telephonic and video, made up less than 1% of the patient encounters. If you look at where we are today, I don't know whether we're in a steady state or not, but we seem to be in a relative steady state. And today, about 9% of the specialty visits and 11 to 12% of the primary care, urgent care visits are done virtually. And again, 65% video, 35% telephonic. I mean, and there's some areas like psychiatry where 70% of the interactions, are all done virtually. So I've heard, from people at Duke that the pandemic, the silver lining here is it has brought forth by years, the adoption of using, these kind of virtual patient visits, to made it really a reality. But again, we bump up with some of the other issues that I discussed before around access and affordability. It's not today for everybody, but for those that have access and, and there is affordability, I mean, it's an amazingly successful and effective tool to be able to allow, patients to be managed in, at home. And it's also very efficient for the health system. It allows, Duke to free up space to be able to do other things other than have people kind of come in for a particular visit.
Mm-hmm. How about you, Dr. Linder, for Nebraska Health? How has COVID-19 changed the way that you have been delivering care to your communities?
Well, Nebraska Medicine, the experience we've had is very similar to what Bill articulated at Duke. We went from 1% to over 40% in some areas, psychiatry even higher, and then settled in at a steady state of 15 to 20%, depending on the specialty. And it's caused us to rethink the office environment for the providers. It's put more emphasis on our patient access and scheduling systems. We have been embracing the concept of a digital front door for a couple of years now, and it's probably accelerated the use of our app as a Nebraska Medicine digital front door by at least a year. Mm-hmm. And you say, well, why didn't we do this before? And, the dirty secret is that people would not pay for it. And what's happened is there's been waivers that allow reimbursement for telehealth services. We hope that people realize the value and the efficiency of that so it can stay part of both the public and insurance reimbursement that exists today.
So do either of you have a sense if any of these waivers of reimbursement will continue to live with us? Is there any indication of that?
The Center for Medicare Services has said that they would. And we find that different third-party payers have different views on this and what they actually require to achieve payment. One of the fascinating things that we've been exploring is digital dermatology. If you look at Nebraska, a lot of people working in rural areas, a lot of sun exposure, they're not dermatologists out there, but they can see their primary care provider and an image can be captured of a suspicious lesion, and remotely that lesion can be looked at by one of our dermatologists and recommend the proper treatment. So you want asynchronous care available. You also want synchronous care. And you also want to remove any requirement that you have to physically first see a patient before then you can start having a regular telehealth encounter with them.
Yeah, someone mentioned to me that they view the outcome or the actually future of waiting rooms, healthcare doctors' offices and clinic waiting rooms will be like bank lobbies, empty. I'd like to know all of your thoughts on that.
Well, of course, the pandemic has an impact in Germany. So on both sides, the patient side and the doctor side, I think the same in the US, things speed up dramatically. That it would happen without the pandemic. But you see also the struggle, as I mentioned, some doctors are not able or willing to use digital tools. Some patients shy away. We don't have due to our social security system, the financial aspect as strong. But of course, a lot of people want to see the doctor as social interaction. And I think there are some screening or other therapies and diagnostics you have to show up in physically. But especially when it comes to compliance supporting systems or other things for chronic illnesses, there's a lot of room for innovations. But I think, again, we have to explain it to the people, and people should be used to use it. And as long as we don't have the resources to really do a wide outreach and training to the people and deliver them comfort and safety, and that is a challenge to get it accepted. But the pandemic speeds things up, and that's kind of a good thing of a pandemic.
Frank makes a very good point there, in that if you consider the fact that before a patient is seen, you may want laboratory tests, you may want x-rays taken. So I think you'll see health systems evolve to have these outpatient centers where the pre-work can be done before the telehealth visit.
Mm-hmm.
Perfect.
No, I think absolutely. I mean, again, the fact that we have the technology in many respects today that can allow you to, have these kind of virtual visits, or to be able to collect certain data that will be necessary for the physician, to determine the right sort of way to care for that patient. But I think Jim said something, at least in this country, which is very important, and that is, there's got to be the reimbursement. It's got to be there, otherwise it's just not going to happen. And I'm encouraged. I think that the payers, are coming to appreciate, that the technology, not just for doing telephonic visits, but for monitoring or for measuring certain things, is there to be done in the home. And so you have now a number of companies who are developing these wearable sensors that allow you to monitor a patient's heart rhythms over a continuous period, which gives you probably better information than what you would get if you just went in and had an EKG done. And so, and now payers are paying for that. So I think the whole system needs to kind of coalesce here with the technology, with the payers, and with the providers all looking at what is the best way to design care for certain patients.
So as innovative industry leaders, what do you think is the next big thing that's coming down the pipeline to just really change the game and make everyone's life, well, let's just say improve outcomes, which is really the desired goal? I'll start with you, Frank.
Mm-hmm. For me, the more or less 2 or 3 things. One thing is connectivity. So we see a lot of innovation here and there, but you have so many digital systems now, they don't speak to each other, so to say. So I think we need more standards to exchange data and to make it for physicians and caregivers more easy to use different systems to get the whole thing done in one environment. B, for me, skills. So we have to also train our doctors, our nurses to use digital solutions. They're not all digital natives, I'm sorry. So I think we really have to also change things in education and in curriculums. If you become a nurse or a doctor, digital knowledge should be given due to your exam. And last but not least, I think we have to increase co-creation with seniors. So we have a lot of smart people who designing for seniors, but not with seniors, and they develop lots of things and they put it to the market, and then it failed because the UX or UI experience is not what this type of user need to experience. And I think that are three big things that could happen soon to really get things done and to get the acceptance rate much higher than it is now.
Co-creation with the people who are going to use it. Imagine that.
Yeah, we could.
Yes,
We did a research project on that. It will work.
Dr. Linder, what do you think the next big thing is going to be in regards to healthcare innovations?
Well, Bill mentioned wearables, and certainly I think that's with us now. And as time goes by, they'll get smarter. I also think we'll see devices incorporated into the environment we work in. You can imagine for a person who was elderly, monitoring their movements around the house to provide a signal that care might be needed if they were not ambulating as much as they were. And I think we'll see more use of expert systems, both in the continuum of care, on the preventive sense, as I mentioned, to actually in the delivery of care, where systems can certainly facilitate what work the physicians are doing. And then we haven't touched on the whole notion of precision medicine or precision healthcare, which could take hours of discussion. I mean, once we have that information about the genomics, the proteomics, the metabolomics of an individual, how does that relate to how we deliver care to them, how their diet is managed, what tests they have? I mean, this is going to be an exciting period of time ahead of us.
Well, first of all, I want to just pick up on one thing that Jim said, which in terms of what I think is the next big thing. And I've been in the device world my whole career. And for someone like me to say what I'm going to say is maybe a little out of character, but I am really excited about, where we are, with, the tools that we have to do gene sequencing and this whole new field of precision medicine, to be able, to determine early on who's at risk, and then to be able to prescribe the right kinds of therapies, for patients. And so I 10 years ago, I would have said that gene therapy is in the future and will always be. But I would tell you now, I think that we are on the cusp of being able to not just palliate diseases or treat symptoms, but we're on the cusp of being able to cure real diseases, which will have a profound impact on the whole healthcare system. The other thing I would just say in terms of next big thing is going to be this whole field of data science and artificial intelligence, the ability to use digital technologies to be able to better, screen, or read, or to be able to correlate such that, we can, find certain things that maybe, physicians or caregivers, maybe weren't able to observe. And so, there's a whole revolution that's happening with this whole field of kind of data science, which is enabling things like gene sequencing, as well as things like being able to look at data sets and be able to correlate and to be able to then find out maybe what segments of the population are more at risk.
How close are we to really taking advantage of those types of services?
I think it's here. I mean, there's exciting stuff that's going on right now. I mean, the problem in the sequencing, it used to be, someone would say it was maybe $1,000 to do the gene, sequencing test, but $1 million to do the interpretation, because it just took so much processing to, analyze, all the data sets. But that's all changing. And so now, we're going to be, I think, in the very near future, sequencing almost all patients that come in, or newborns that are born are going to get sequenced. And we're going to then, have a real sort of, if you will, map of that person to, from birth, to be able to then know where they are likely to be at risk and be able to then figure out what you're going to do. And that's where I think we'll be lagging, is that we may, unfortunately, have more of a diagnosis and we have more therapy and less and need more therapies. So, but I think it's here. We're seeing some of these capabilities being used today, and so it's beginning to transform, how we really think about care and treating patients.
I think this is probably one of the most exciting, and I know everybody thinks that who's in healthcare, but I truly believe this is one of the most just important times and just a consequential time to be in healthcare right now. I'd like to, for Dr. Linder to start with your final thoughts on just really the tremendous opportunities we have before us with tech and touch.
I don't think it's an overstatement to say that technology has always been the most disruptive force in healthcare, even before people talked about technology. If you think back 100 years ago, 1921, we just came out of a pandemic. At that time, there really weren't aseptic procedures in hospitals. There were not antibiotics. There were not EKGs. There were not medical devices. Wasn't really good pain management. But people still needed care. And they got it. It was mostly supportive. And now we're at this threshold of taking advantage of the tremendous technologies that are available to us through our understanding of the human genome, biology, incredible computing power, taking data sets together, being able to design new pharmaceuticals. The rapidity of developing a COVID-19 vaccine is a testimony to that. So I think we're going to make great impacts on health in the next few years. And the challenge is to make sure that we bring it forward in an equitable way and make sure everybody has access to it.
Frank?
Yeah.
What are your final thoughts on this?
I couldn't agree more. I like to add from German point of view, the speed of innovation is much faster than it was years ago. As you mentioned, vaccination within less than 10 months. I think we also have the administration and the cost carrier to really deal with the speed of innovation, and that they really can be sure that it is a good innovation that's worth to pay for it. So I'm a bit afraid of the bureaucracy behind the payments and the coverages. If they could speed up with the speed of innovation we will have.
And Bill, what are your final thoughts on just the opportunities we have in front of us here?
Yeah, I'm going to go back to the founder of Medtronic, this guy Earl Bakken, who started Medtronic in 1949, and he retired from the company in 1989, but he didn't retire. I mean, he went on from being sort of the, if you will, the entrepreneur founder of the world's largest medtech company. So then he moved to the great big island of Hawaii, and he started a hospital that was focused on blended medicine. And his thesis was that scientific medicine is only about 20% effective in the total healing of a patient, and that the other 80% is the human, caring, holistic approach. And if I think about, the past and even the present, so much of what we've been focused on is in the tools to be able to get sort of information from about the patient to be able then to make the diagnosis and the treatment. I'm excited about the future in terms of we're going to have that data is going to be there for us. And then it's going to allow the physicians and the caregivers to spend more one-on-one personal time with the patient to deal with not just the illness, but more being kind of a real caregiver and really addressing more of the, if you will, the human touch aspect of care, which in the past, was maybe, not overlooked, but there was a time for that. And now we're going to have more time to really spend with the patient, on, the psychology side versus just the therapy side.
Well, thank you all for your insights. I couldn't be more excited about what's on the horizon. And a great point, Bill, because with all this technology and all this data, we must not lose sight of the human touch side and the human interaction side.